Hey everyone, welcome back to Project Honesty, a podcast designed for young adults, by a young adult, to gain brutally honest, friend-like advice, as well as provide a platform for young adults to form opinions, color outside of the lines, take deep dives into current events, and most importantly, have fun. This is Project Honesty, navigating reality with real conversations and diverse opinions. Hey everyone, I'm so happy to have you all back for Project Honesty's 6th episode. In last week's episode, I briefly mentioned what we're going to be talking about today. So this episode is bouncing off of last week's topic, and we're going to be focusing on women's treatment in healthcare. It is something that I did mention briefly, but I didn't really want to go into because I felt like I could extrapolate it into another episode, because this topic is something I've seen a lot on social media lately. Women going on their Instagram and TikTok to express their concerns about their treatment in the healthcare system and the care that they're receiving from healthcare professionals. From last week's episode, we can infer that feminism does definitely advocate for women's healthcare and for our illnesses to be taken seriously and not blamed on our reproductive system. That's something that we're going to be focusing on today. Getting right into it, the history of women's healthcare and how it impacts modern day medicine and women's healthcare overall. Some of the history. So we're going to go all the way back when medicine in general was a new, undiscovered, and inaccurate concept. So in 3rd century BCE, Aristotle described the female body as the inverse of the male body, leaving it to be seen as faulty or defective. The female body was only seen to be served for bearing children, and most medical mysteries were blamed on the undiscoveredness of the female reproductive system. Blanket statements to diagnose were not unfamiliar, and a woman's highest value and purpose in life was her uterus to produce children. That was about it. That's kind of where scientists and philosophers and founders of medicine kind of stopped. They didn't really care enough to go further in depth into the female anatomy, and so this really laid the unsteady foundation for our early understanding of women's healthcare. Some things to point out: women were, and still are, seen as objects that serve the sole purpose of having children. Some people see women being stay-at-home moms, and that's a totally awesome career, but not every woman wants to do that, and not every woman, including myself, want to have children. It's something that doesn't interest me. I'm very career-based. And on the topic of children, having children back then, especially back then, was very, very dangerous. And in my research, it was very hard to find accurate numbers of maternal mortality rates before the 16th century. So instead, let's analyze data released by the World Health Organization in 2020. So this information is still very, very new. In 2020, the World Health Organization said that around 800 women every single day in 2020 died from a preventable cause related to childbirth and pregnancy. Most of these deaths occurred in low-income or lower class countries where access to proper women's healthcare isn't an option. So that just brings up the point that having access to women's healthcare isn't an option for everybody. Yet, this healthcare is very essential and can save many, many lives. Jumping into modern day women's medicine, we analyzed how women were viewed from the first discovery into women's healthcare. Now we're going to jump into what it is now and how the early discoveries in women's medicine impacts modern day women's healthcare. Things that will be discussed are researched and facts, but also personal stories that have been shared on social media media that I've seen that I wanted to talk about. Healthcare systems have definitely improved in research when it comes to women's healthcare. Compared to 3rd century BCE, we have come a very, very long way. Women's healthcare clinics with mainly female staff have been created in some areas of the world, including Canada, to provide women with a safe and non-judgmental space where their illnesses are taken seriously. With that, there are still many elements to the female anatomy and women's healthcare that we don't understand, and there's a gap in research. And due to stigma from society, many women don't express the pain they're feeling because of fears around misdiagnosis, which is a common fear to have as a woman in healthcare. Talking about periods and period myths, yes, we're getting into this. No, they are not gross. Periods aren't gross. They're so normal. Half the population gets a period. And I think there's a lot of stigma around periods. For what reason, I don't know. But there is. And so today I'm going to break a little bit of that by discussing how a lack of research in women's healthcare impacts menstrual cycles. So a couple myths around periods. Period symptoms like PMS don't happen to everyone, and they can also indicate problems with your health. If you're experiencing really bad PMS, I know that I do sometimes, like acne, food cravings, really extreme cramps, that can indicate another problem with your health. Speaking of cramps, the message going around saying that cramps are as painful as a heart attack, yes, they can be. According to research conducted by scientists in the UK in 2018, they proved that period pain can be equivalent to the pain of a heart attack, which is insane because sometimes I can be sitting in class with horrible cramps and nobody around me will know because that pain is not usually talked about because it's stigmatized, and it is something that shouldn't be. Periods are normal, again, and the pain that comes with them should also be normalized. Women often get shamed in the media for taking a day off to manage this pain, but in turn, if a man said he needed a day off for his pain, there would definitely be different reactions. But when it comes to a woman and her period, we are expected to brush off our pain and continue working and doing our best, when in actuality, we cannot perform at our peak performance. Something in the healthcare system that is slowly starting to be recognized more in the media is hormones are everything. Most issues that have to do with periods are almost always blamed on your hormones. But the pain from your periods can actually be due to a number of things: cervical cancer, endometriosis, vaginismus, and other uterine-related illnesses that are sometimes missed. A lot of doctors won't or don't usually take the time to investigate these things and instead put a blanket statement over their diagnoses and blame it on hormones. When it comes to comfort in women's medicine, something that women don't see a lot, medical exams and medical devices used in women's healthcare are outdated and uncomfortable. An example of this, and it's a perfect example for this situation, is speculums. Some of you have heard this referred to as the jaws of life. Speculums were developed during the Roman Empire and are used to force the vaginal walls open for medical purposes. And since then, it's been seen as the only way you can receive a pelvic or vaginal exam is if you use a speculum. If you don't know what a speculum is, go Google it because it's insane. But if you do, I'm sorry that you've had to experience one. There have been innovations to the speculum, but the original design is still based on the model or the first models invented in 753 BCE, which is crazily outdated. I don't think any of us are using anything that has to do with medicine from 753 BCE, especially in invasive exams. When it comes to contraceptives, an example of a lack in research or a lack in care is IUDs. IUDs stands for intrauterine device, and it's a common form of long-term birth control used by a lot of women to prevent pregnancy. These devices are incredible. The technology behind them is incredible, the design is incredible, and it is definitely a highlight of advancements in women's healthcare. But there is one major problem. During these invasive and sometimes painful procedures, women aren't given painkillers. Some women I've seen on social media have shared their stories of passing out during getting an IUD because of the pain. Because when they put an IUD in, it doesn't just go in your vaginal canal, it goes all the way up to your uterus, which is a painful process. From patient sign-out sheets that I can Google, doctors recommend taking Advil or Tylenol after your appointment and say that you can go to work either the same day or the next day after having this procedure done. Some doctors even recommend patients to get a ride home instead of driving themselves because of a risk of passing out, which is insane because we shouldn't be told that this is a minimally invasive procedure that will not hurt and that we are able to go to work the next day, when in actuality, women are suffering and have a lot of pain caused due to this procedure, and it is being dismissed by healthcare professionals. Overall, advancements and dedication to women's healthcare need to happen now to ensure that women are getting the healthcare they deserve and that they aren't getting misdiagnosed due to a lack of research. Outdated forms of medical care can be researched to develop a new way to treat female patients according to our new understanding of how female anatomy and the reproductive system actually works, because most of it is actually based on really, really old research, and it's unfortunate. So the second half of this episode, I want to get into something that is a touchy subject. We're going to be talking about women's healthcare in media and politics, and the influence that media and politics has on women's healthcare. I did briefly mention this in last week's episode. So our focal point and analysis for this question will be Roe v Wade. This will be our prime example for talking about women's healthcare in media and politics. Trigger warning, we will be discussing abortion. This can be a sensitive subject. I'm going to start off by saying that I am pro-choice. I believe that abortion is a life-saving and essential part of healthcare. It's a procedure that should be left as a choice for the patient, their family, and the providing doctor. My belief does not have to be your belief, and it is your decision regarding whether you think abortion is okay. And if you're against abortion, I highly encourage you to challenge your own perspective and listen to the next part of this podcast with an open mind. Because you never know, you might learn something. Another reason I believe in abortion is my mother. Before I existed, she had an ectopic pregnancy, and without this life-saving procedure, my mom could have died. So being pro-choice hits home for me. Being pro-choice, it's not my decision to force people into doing things that align with my beliefs. I would also want to be able to make my own decisions regarding my body. I still do. And banning abortions does not stop them from happening. They're still happening. It just prevents them from happening safely. With that, many people know what Roe v. Wade is, or at least they have heard of it being overturned in June 2022. But I'm not just going to speak about the overturning. I'm going to go through a little bit of a timeline from where Roe v. Wade started and where it is now, and the consequences that had, and the influences that media and politics played in the Roe v. Wade case. Starting in 1969, a Texan woman named Norma McCorvey, aka Jane Roe, that was the name she was given for the case, wanted an abortion. The district attorney, Henry Wade, sued Norma for her violation of the abortion laws that were in Texas at the time, which was women could only access abortion to save their life. McCorvey's lawyers, Sarah Weddington and Linda Coffey, pushed against the Texas legislation, stating that it violated McCorvey's right to privacy that is outlined in the 14th Amendment of the United States Constitution. Jumping to 1973, the U.S. Supreme Court decided that abortion was a protected fundamental right under that 14th Amendment, with the vote being 7-2. In 1992, new restrictions to the right and access to abortion were introduced after the case called Planned Parenthood versus Casey, with the decision being 5-4. This decision made it so that states could ban abortions in the first trimester for non-medical reasons. In 2017, Trump appointed new Supreme Court justices, making the Supreme Court majority Republican court. Jumping to Roe v. Wade's overturning, June 2022, Roe v. Wade being overturned, giving the states the opportunity to ban abortion once again after decades of being able to have access to abortion legally. So what did overturning Roe v. Wade mean? It meant that half the predicted states in America were now expected to ban abortion, and they could do so legally. I'm going to leave a link to a BBC article explaining more of the aftermath of Roe v. Wade and the groups that were specifically affected by Roe v. Wade. Roe v. Wade is one of, if not the biggest display of how media can positively and negatively impact women's healthcare, and the influence and responsibility that politics has in conversations and legislation surrounding women's healthcare. So I know this was a little bit of a short episode, but there was definitely a lot of things to talk about that I wanted to separate from the feminism episode. With the conclusion of this episode, I want to ask, what is your opinion? Where do you stand, and why? Take the time to consider why decisions in women's healthcare can affect you and how it affects those around you. So I know this episode was very information heavy, but thank you for listening to another episode of Project Honesty. You can find Project Honesty on Spotify at Project Honesty or on YouTube at Project_Honesty. And to keep up to date with new episodes, you can head over to Project Honesty's Instagram, which is at Project_Honesty 24. Thank you so much. Bye-bye.